Hi, good morning. My name is Kike, your host today on the podcast White Reflections by Hadufe. White Reflections by Hadufe is a podcast that delves into the complexities of life and modern day family dynamics. As you all know, what we try to do on the show is we try to bring people with real life experiences on the show to come share the experience with us. Perhaps somebody going through something similar can benefit from it. We also try to bring experts on the show to come share the wealth of knowledge with us. Perhaps also somebody going through something similar can benefit from it. Today, we shall be talking to Mrs. Olufunke Olayiwola, a public health practitioner and a woman activist. Together, we shall be navigating the use of contraception within a patriarchal society like ours. We shall be talking about how sociocultural and religion has affected, the use of contraception and the decision of patients when it comes to contraceptives and family planning. We shall also be touching on the male gender's involvement in contraceptive or contraception or family planning, so to speak. Do you think personally that the male gender should be involved as well in contraception or family planning like women do, like the female gender? Do you think that methods like sterilization, vasectomy, male sperm blocking gels and all of that should also be introduced to the male gender? Do you think that the male gender should take responsibility of their reproductive future just like women do? This and many more we shall be talking about this morning. Join us as we have this interesting, enlightening, educative conversation. Thank you very much. Good morning, Mrs. Olayiwola.
Good morning.
Thanks for coming on the show,
Thank
ma.
you.
I really appreciate, ma.
Thank you.
Yes, ma. So, very quickly, ma, I'd like you to tell us, what do you do?
Thank you. Like you said in your introduction, I'm a public health practitioner. What do public health practitioner is? I specialize in educating a citizen on how to live healthy, how to promote their health. Although I have a nursing background and a midwife, but majority I educate people on how to prevent diseases and how to live healthy. So okay. That's the work of public health practitioner.
Public health practitioner. Thank you very much. But on today's podcast, we shall be concentrating on contraception,
Sure.
The use of contraception in our society, and how it has affected a lot of people when it comes to making decisions about contraception. What can I do? What can I take? And how can I prevent, some of these occurrences? I mean, getting pregnant unnecessarily at, any given time and all of that. But first and foremost, I want to ask, is family planning the same as spacing?
Yes.
Okay.
What is really family planning? According to WHO, family planning is just anticipating what kind of family number are you going to have. That is, what number of children are you going to have? What space are you going to make in between them? How are you going to have them? So when we are talking about family planning, it's a conscious decision, both as the man and as the woman. That is, how many family do I want to have? That is what we really mean by spacing between one pregnancy and another one. So that's also the same thing as family planning. But how are you going to achieve it? Maybe by using commodities. That is why family planning, commodities, contraceptive methods come into play.
Okay, thank you very much. But I've come to realize that in our society, it's very difficult for a woman, so to speak, to take decisions when it comes to family planning and spacing, especially coming from the cultural aspect and the religious aspect. I know a number of culture that would say a woman has to give birth to all the children placed in her womb. And I know some religious views that would support that as well, that a woman shouldn't go on family planning or contraception. And I know a number of women who have passed away in the process of having frequent pregnancies and multiple kids without spacing. So I'd like you to talk on that. How has the cultural and the religious aspect of things affected a patient's decision?
Thank you. Like I said, I used to educate people on healthy living. One of my duty is to educate the general public the importance of family planning at home. Maybe by the time they know the advantage of family planning, they will embark on doing it. So, but the majority of the problem that we have in our community is myth and a misconception about family planning. Majority of our forefathers, of our grandpa that are still around, they look at any woman that is doing family planning as that one wants to become a wayward, and that's why he's going to do family planning. No, like I told us, the meaning of family planning is just for you to anticipate when you want to marry. How many children do I want to have? What are the space I want to make in between them? How am I going to do it? But you see that it's not only what you can think alone. You just have to take some steps. So culturally and religiously, we have been having breakthrough in that area now, because we involve our cultural leaders, our traditional leaders, and our religious leaders. How do we do that? We go into their midst, we educate them, and we let them know that family planning is not a license to become a wayward person. And there is no woman under this earth that can be able to give birth to all the
children placed in her womb.
If any woman is going to do that, is going to kill herself. We let them know, and we let them know the importance of spacing between one pregnancy to another. Like WHO make us to understand that it is very, very important, if a woman going to be healthy, that at least there should be 2 years interval between one pregnancy to another. Not between a child, between one pregnancy to another. That means when you finish one pregnancy about 2 years ago, that is the next time, 2 years more, that's the next time you will now think, I want to be pregnant again. But you cannot do that on your own. There are some commodities, like contraceptives, that is now in vogue that you can make use of. Culturally and religiously, they are now seeing to the importance of not only woman, even men too. Let me give you an instance. I was in one of our communities, let me just say it, Akpete, and I went there to educate them on family planning, and I went with condom. You will see that even women are shy to collect condom. But men, they came around and they collect condom. And I was asking them,
do you think they will use it?
They do. When we are going, I will tell you another thing. They use it. So, and I asked them why. They say, if you don't want to have many children, you need to use it. Okay, so many people too, culturally, traditionally, they are aware of it and they want to embark.
Thank you so much. I'd like to quickly ask, do you think in the process of spacing, you said 2 years, that is what WHO recommends. Can you do it naturally without being on contraceptive?
Yes.
What's the natural method?
Okay, that's what we have.
Of planning a family.
Family planning is in 2 sections. We have natural method, while we have artificial reversible method. The natural method is what we call fertility awareness. What do we mean fertility awareness? That means when you will detect what we call safe period. So what do we mean by safe period? For the natural method, we have the what we call fertility awareness method. We have a breastfeeding amenorrhea method, that means lactation amenorrhea method. Then we have what we call withdrawal method. Those are the natural method that we have. So the fertility aware method is the one you will look at your menstruation, ovulation, when you will try to look at where do you ovulate, and that one is so technical, so that you need to know when is your ovulation time.
That's so, if you have a stable menstrual cycle.
When your cycle is around 28 days. Okay. So you will like to detect your ovulation time. So the 14 days of your menstrual cycle is supposed to be your ovulation day.
The 14th day.
The 14th day. So the 14 days, so you will be 2 days before, 2 days after. So about 5 days of your menstrual cycle is what we call safe period. So that's that safe period is that those periods that you will not be able to,
it's unsafe.
It's unsafe. It's unsafe for you to meet your husband if you don't want to get pregnant. But if the time you want to get pregnant, that's the time for you to meet your husband. So that 5 days, the 14th day, which the day the ovulation happen. So 2 days before that, 2 days after that. So that 5 days, you must leave it and you must not meet your husband.
How effective is that?
Yes.
What's the percentage?
Like I research, if you know how to do it, if you are technical about it, it's about 98% effective.
98%. Wow.
Yes. It's about 98%.
That's if you know how to count it. We are very accurate with it.
Yes. Okay. So that one is about fertility awareness. Then we call that one lactational amenorrhea method. That is the time a woman is breastfeeding. So when a woman is breastfeeding, there is what we call hormone prolactin. When it's being released into the system, it will suppress the release of the egg of a woman. So when that egg is not released, so even when a man meets that woman, there may not be fertilization. But for anybody to do that one, that person must be doing exclusive breastfeeding. So that means both in the day and in the night, and it must be for the first 6 months. Immediately after the first 6 months, the prolactin will be reducing. So immediately the prolactin is reducing, there will be release of the egg. So that one too is very effective.
But just for 6 months?
It's just for 6 months.
Okay.
Then the natural one, that is third one, is what we call withdrawal method. So that means when the intercourse is going on, when the man wants to ejaculate,
he has to pull out.
He has to pull out. So those are the 3 natural methods.
But in the process of pull out, he has to be sure that pulling out, rather.
That one is the only one that, out of the natural method, is the only one that have about 73% effectiveness. Because we don't know how sure that even during the meeting, some of the sperm may have escaped before the full ejaculation, and the woman can get pregnant. So majority of the time, so those are the natural methods that we have.
Okay. So can we go to the other method, the
artificial method. The artificial method too, we have the barrier method and the contraceptive method. What are the barrier method? The barrier method is the one that you are not using anything, you are not using any pills, you are not using any injection. What are the barrier method? The barrier method are the condom. The condom, the male condom and the female condom. So those are the barrier methods.
How effective is the female condom?
The female condom,
and are they readily available?
They are readily available, and even women too, they are now.
Do you give them out when you go on?
Yes, and they use it very like my daughter just came home one day and she said that one of our church member, she's in search of a female condom that she needed. So I went to pack it and gave it to her. She was so happy. They are using it. Women are using it because, what the purpose of condom is that condom make us to have spacing when it comes to unwanted pregnancy. At the same time, it protects us from STI, sexual transmitted disease. So those are the two things that the barrier method do for them. It space children and also protect them from unwanted pregnancy. So those are the barrier methods. Then we have the commodities, that means the contraceptives. We have the hormonals and we have the one that is not hormonal. The hormonals are the pills. We have the pills that the woman will be taking every day. Like we call it, don't forget me. They will take it every day. Pills, yes.
Once a day.
Once a day, we call it contraceptive pills. So what is I will say they are the hormonals, the pills, the injectable. The injectable, we have the one of 2 months, we have the one of the 3 months. Then we have the one of implants.
Okay.
We have the one of 1 year, we have the one of 4 or 5 years. So those are the hormonal. So what is the work of the hormonal? That hormonal one is like they use our hormones in our system to do it. So whenever it's going to our system, what is it going to do? It will suppress the eggs, the ovary, not to develop. So immediately it's not developed. If it's not developed, the egg will not be released, so fertilization will not come on. So the hormones work with our system. So that's the one of the. Then we have the one where we call intrauterine devices. Those are the copper T, the lipid slough. That one too. That one is not hormonal. That one is just placed in the uterus of a woman, and that one it can last for about 12 years.
12 years.
12 years. So it will just be placed in the uterus of a woman. And what is that one do? It will not allow the egg that they've been released to meet with the sperm of the man that is being released. So what is it doing? Where fertilization is supposed to take place, that's where he has occupied. So because he has occupied the place, so fertilization will not take place, and it can last for about 12 years.
Thank you very much, Mrs. Holayiwola. Now I want to come to the negative, rumors that's been trailing contraceptives, the use of contraceptives, and all these family planning, artificial family planning methods. I've personally heard people say they would never ever do it. I've heard people remove. I've seen people who have done it and who have rushed down to the hospital to get them removed because of the side effects, the complications. Some will complain about excessive bleeding, headaches, and all sorts of things. How true are these? Are they myths or are they facts? And why are you supposed to test people before administering some methods of family planning on them, or you just go ahead and you administer, you give to them without even testing them?
Thank you, my sister. When we talk about contraceptives commodities, they are drugs. They are chemicals. It's just like our paracetamol, the least drug that we abuse so much. It's like our paracetamol. As paracetamol is so popular, you find out that some people cannot use paracetamol. Why? Because as paracetamol is so popular, it still has its side effects. So the same thing with these commodities. And like I told you, they are made of hormones. That's why they call them hormonal. So because of that, when we use it, there is no, I say that some will have side effects. But the side effect, it does not mean it's not working. Let me give you an instance now. When you use some antibiotics, now, they can tell you, when you use it, you may feel some rashes, you may feel this. it does not mean that antibiotic is
It's
not working. You understand? So neglect about the side effects and the work of that.
But if the side effect is really previous,
I will come to that. I will come to that. So neglect about it and just go ahead. That's number one. Number two is this: majority of us, because we have had a lot of misconception, misinformation, some minds that are not true. So is that idea that we are bringing to family planning clinic that say, they say that do this, so you do that. No, it's not like that. Normally, when a woman enter a family planning clinic, we ask them a lot of questions. We examine them. We check their BP. We check their weight. We ask them what are those things that they are allergic to. So by the time we find out of all those things, we now told them all the commodities we have on ground. We let them take their informed choice. Which one do they want out of all this one that we have explained to them? When they now choose one that will be very adverse to their health, we will tell them. Maybe, let me give you an instance. If a woman with a BP of 150, 100 choose injection, we will now tell them, this one is very good though, but because of your BP, we don't think it will be okay for you. Will you take this one? We think this one will be okay for you. So those are the way we used to treat them. So normally we will examine them, we will test them, we will do a lot of things for them. But at the same time, it does not mean because one of them, some of the women, when you take it, you may be having small blood discharge. Is no problem. You may have some, even when you take antibiotic, we tell you you will have headache. What do? You will use paracetamol. That means if it does not give us those things, those effects in your body, it's telling us it's not working. Let me just give you another insight. When we take BCG for our children, what will happen? You will see that place swelling. So what do we tell you? Don't worry, it will go. So the same thing with family planning. So when you take it, you may see some things happening. There is no problem.
Why are you saying those reactions will subside?
Yes, it will subside with time. Okay. And as we subside, you will enjoy yourself.
And very quickly, what are the chances of getting pregnant after family planning, after removing it?
Sure. The work of each of them, like when you take injectable of 2 months, let me tell you, you work for only 2 months.
For only 2 months.
Only 2 months. So
once it's expired, you either you renew or you are ready.
So majority of them is for that specific time that we ask you that it's going to work. That is going to work.
But I've seen people get pregnant while on family planning.
Yes.
Why? Why is that?
Yeah. Let me. Like I told you, it's a drug, and it does not have 100% effectiveness. That's number one. Number two, they don't use it as they ask them to use it. For those of them that are on daily pills, they may forget it today, forget it tomorrow. They will go and use it the 40th day. So you have break the chain. That's number one. For those of them on 2 months interval injectable, they will not go exactly at the day they're supposed to go. So they will say, we'll go next week. So in between that interval that you left, so you find out that when you have any intercourse at that time, surely pregnancy can come. But at the same time, no family planning. Even the permanent method, the one that did not even mention at that time, the permanent method. As we have permanent method for the men, we have permanent method for the women. So the permanent methods too, at times when you do it, at times there is no family planning that is 100%. It can only be 99%. And the 1% it can happen.
So you have to leave that window open. So I want to ask you, Mrs. Olaiwola, have you ever had people bring in their teenage daughters for family planning?
Yes, no. Reason be yes, no is this. Let me mention the no verse. No is that what we preach to the teenager is total abstinence before marriage. That's what we preach to them.
But if a parent knows that,
yes,
the daughter
so the yes part of it is that when you know the teenager is sexually active, when you realize they are sexually active, there is nothing bad, because they are now, because if you don't introduce them to family planning, they will get pregnant and they will do criminal abortion and they can terminate their life. So immediately you know they are sexually active and you cannot control them, introduce them to family.
And as a mother, if you want to be truthful,
yes. So like
if you want to be realistic,
yes, I went for an education sometimes ago, and the father accused me that we are the one that are teaching these children waywardness.
To be wayward.
Why are we now teaching them family planning? And I told the man that we know them more than you people. Many of them, you don't know them at all. Some of them come to meet us, we find out they are HIV positive. Some of them come to meet us, we find out they are pregnant, and they come on to do abortion. So you may be looking at them as saints.
Do you do abortion for them?
No.
Okay.
That's why you are saying criminal abortion. So they go about doing it criminal.
So what's criminal abortion?
Criminal abortion, you know, abortion is not legalized in Nigeria.
Legalized in
so anywhere that they do abortion that is not therapeutic, there are some that abortion that are therapeutic.
Now medically you have been advised
that you look at that woman, that pregnancy that can terminate the life of that woman. So that is what we call therapeutic abortion. But anything apart from that in Nigeria is criminal abortion. Because it's not legalized. So that's why. So I told parents, immediately you see your
teenage daughter,
your daughters that are sexually active, the best thing, introduce her to family.
What about your male sons, teenage sons?
Yes,
you give them condoms.
You give them condom. Yes.
Wow.
Yes.
Wow.
Yes. That's it. But what we preach to them is total abstinence before marriage.
Okay. Thank you very much. So, very quickly, I want to talk about the male gender's involvement in this. What's it called now? Family planning. In your opinion, Mrs. Olaiwola, do you think men should be involved? Do you think they should also take responsibility of their reproductive future, just like women do? We educate them. Like I remember one of my ogas, he's a medical doctor, and he purposely did vasectomy. Wow. And why? He said he has to take responsibility of the type of family he's going to have. So immediately he did that. He said he has had enough children that he planned to have. Even if the woman will not take any family plan, he has taken his own responsibility. So the vasectomy, what does it entail? The vasectomy is such a minor surgery for men where their fast difference, that means the tube that carries sperm from their testes, is being cut and tied. While the bilateral tubal ligation is the fallopian tube of a woman that carry the tube, that carry the egg from the ovary, is being cut and tied. So those are the... That's your boss must be warning. They are doing it too. Only it's not unfair. They are doing it. Men? Yes. In Nigeria? In Nigeria. That's when I was at UCH, we don't have many of them. They are doing it.
I have another one too. The man marry a sickle cell woman, and the lady cannot do any of the family planning. The man volunteers to do vasectomy. They are doing it. Only is not, but
are there other methods of family planning for men?
No, we have only two: condom, use of condom, and
I hear there are pills that can block.
No, for now.
Oh,
for now, we have only two methods for men: use of condom and vasectomy. So those are the methods we have for men. But we encourage them that they should encourage their wife to come out for family planning. Even they should encourage their wife to go and take their next appointment. So we encourage, and they are doing it. They are doing it fantastically.
Thank you very much.
Yes.
So how often do you go to the rural areas to educate them, to talk to them?
Yes. In fact, me, I'm a rural person, like I told you. Yes. I told you. Yes. I was in Akpete, educate people. We go most especially we go through the traditional leader. We go to market.
Exactly. I think you have to, because there are some communities where you can't just go in and.
No, any community you need to enter, you have to go through the traditional leader. If you want to enter the market, you have to go through the.
And the acceptance.
Yeah, they do. Most especially even when you carry some commodities along with you.
Like condoms.
So
they collect and they use.
They even listen. They listen. But the problem is that we have that misconception that is going along. Some women are on family planning, but they will be telling their mates, "They must say that please don't do it." It's just misconception, because they still have that notion that immediately people know that you are doing family planning, you are not a landlord, you are not a prostitute. So that's it. So I used to tell them, many of you people that say it causes cancer, how many people
exactly have heard that? How true is that? Is that a myth or a fact?
Misconception and myth.
It's a myth.
In fact, there some of hormones drug suppress cancer,
like implanon.
Yes, implanon and all so they suppress cancers in the womb. So it's just a misconception. So it's just misconception and means that people have put in their head. Even some of them that they used to tell that he's causing bleeding. How bleeding is that bleeding?
How much of?
So it's just so those are the misconceptions. We let them know the truth and we explain to them. And even if they have side effects, still go back there. When you have side effects, don't go back to chemist and go back to where they do it for you, and they will tell you the necessary action to take.
Wow.
So I think that's
beautiful. Thank you so much, Mrs. Funke Olaiwola. Something for our viewers to take home. Advice.
Okay.
I'd like you to say it in English and in Yoruba as well.
Okay.
I know I have some Yoruba, viewers.
So my advice to every one of us this is like when I was coming to marriage, I decided I'm going to have 3. So family planning.
And how many do you have, mommy?
I have 2. So you just have to decide how do you want your table to look at, and at the same time, if you decide again, how is it going to be okay for both of you? Let me give you what I'm saying. If a man says he's going to have 10 children, is it from a woman alone? So if you're thinking like that, it's going to have a very bad effect on that woman. So you must decide on how many children you are going to have and the space in between it. And it cannot be happen just by saying it. There are things you need to do to do it. So go to family planning clinic, seek for advice, and they will tell you the one that is suitable for you to do without any effect, without any side effect upon you. Ohun tí mo fẹ́ sọ fún gbogbo ara ilé náà ni pé ẹ ṣé o, ẹ kú atótónu wa látàárọ̀. Ohun tá a ti ń sọ náà ni nípa ọ̀rọ̀ fètòsọ́mọ bíbí tá a ti ń ṣàlàyé fún wa. Ọ̀pọ̀lọpọ̀ ọ̀rọ̀ awuyewuye ló ń lọ lórí fètòsọ́mọ bíbí. Àwọn kan á ní kò dáa, àwọn kan á ní kò dáa, àwọn kan á ní ká tiẹ̀ bí gbogbo ọmọ tó wà nínú ara wa ká bí tán kò lè ṣeé ṣe o láti wí gbogbo nítorí pé ẹyin tí Ọlọ́run fi sí inú obìnrin kọ̀ọ̀kan ó lé ní mílíọ̀nù ṣóbìnrin kan lè bí mílíọ̀nù tán so kò lè ṣeé ṣe so à ń láti gbìyànjú láti rí pa fètò sọmọ bíbí báwo la ṣe máa fètò sọmọ bíbí oríṣiríṣi ọ̀nà ìjọba ti pèsè sílẹ̀ láti fètò fọmọ bíbí ẹ jẹ́ ká lọ sí àwọn kílíníìkì wa ká wo èyí tó bá wa lára mu ká wo èyí tó bẹ́jẹ̀ wa mu tá a bá ṣe ìyẹn wà tó sọ pé àní rí àwọn àléébù kankan ẹ padà lọ síbẹ̀ tó bá ń yọ wá lẹ́nu wọ́n á ṣèǹjẹ fún wa wọ́n á fún wa ní mi lẹ́ẹ̀kan sí ẹ ṣé Olúwa wà pẹ̀lú wa.
Thank you so much. Do you speak Hausa?
No.
Igbo. Sorry, we are so sorry about that. Yes. Thank you, Ma. Thanks for coming on the show. I really appreciate it. Thank you so much. I hope you've had a nice time listening to this conversation. If you have questions, I'm going to drop a number on the on our YouTube channel. Till we meet next time. Bye for now.
Thank you.
Thank you. Bye.